Hello, welcome to the third episode of FIP CPD Bites in the series titled Let's Talk About Vaccines. The three-part series serves as an educational tool for pharmacists and pharmacy teams on the benefits of vaccination and specific vaccines in special populations. In this episode, I will be leading you through our third video discussing the importance of the pertussis vaccination, especially in high-risk groups. Understanding pertussis. Pertussis, commonly known as whooping cough, is a respiratory infection caused by the bacterium Bordetella pertussis. It is highly infectious in unvaccinated people. In terms of presentation, early symptoms usually occur in the first 2 weeks. The initial manifestation of pertussis often mirrors that of a common cold. Key symptoms include runny or stuffy nose, mild to occasional coughing, apnea and cyanosis, which can be detected in the lips or nail beds if they develop a blue tint, or extreme fatigue. Progression and acute symptoms can occur from week 1 to week 6 and can extend up to week 10. As the illness progresses, the symptoms intensify and can include violent and uncontrollable coughing fits termed paroxysms, the distinctive whoop sound during coughing episodes, fatigue post-coughing, but a general sense of wellness between coughing episodes, vomiting after coughing fits, and difficulty breathing. Recovery is characterized by a gradual recuperation with a reduction in the severity of coughing. However, fits can occasionally recur. Notably, during this phase, patients might experience general weakness or become more susceptible to other respiratory infections. In terms of severity and duration, pertussis tends to be most severe in babies, although the infection is generally milder in teens and adults and usually does not require hospitalization. They can have serious cases of whooping cough with strong symptoms. The typical infection duration spans 2 to 3 weeks. However, prolonged symptoms such as chronic cough can last for 6 weeks or more. Due to severe or prolonged cough episodes, adults might suffer from issues like rib fractures, significant weight loss, bladder control loss, syncope, falls, and exacerbation of existing chronic medical conditions. The most common complication of pertussis is bacterial pneumonia. In terms of current formulations, DTP is the general global name of the vaccine that includes diphtheria, tetanus, and pertussis. DTaP is the formulation available for children aged 6 weeks to 6 years, whereas Tdap is the formulation that is a booster dose with a reduced quantity of the diphtheria and pertussis antigens for people aged 7 years and older. Age recommendations for vaccinations of older adults may vary per country. Check your local and national guidelines. Vaccines are the best protection against pertussis and its complications. All adolescents and adults should receive a Tdap vaccine booster every 10 years after completing the primary vaccination schedule in childhood. Although vaccination is recommended in all adults, it should be emphasized in the following groups: individuals with chronic respiratory conditions and older adults. Adults living with asthma or COPD may be at increased risk of pertussis. Such individuals face a higher probability of hospitalization among contracting the infection and have a higher likelihood of experiencing asthma or COPD exacerbations. For individuals who are older, they may be at increased risk of developing complications from pertussis. Pregnant individuals should also have special considerations. Tdap should be given during pregnancy between 27 and 36 weeks to protect mothers and infants from life-threatening complications from the infection. Tdap is recommended in the immediate postpartum period for new mothers who did not receive Tdap during their current pregnancy and did not receive a prior dose of Tdap ever. Adults who have or anticipate having close contact with an infant up to 12 months old should also receive a booster to protect the infant. Some common side effects of the pertussis vaccine include localized symptoms such as pain, redness, or swelling at the injection site. Other symptoms include fever, headache, fatigue, nausea, vomiting, and diarrhea. Pharmacists should emphasize the importance of consulting healthcare providers if these symptoms intensify or persist. Pharmacists can play a role in pertussis vaccination. Pharmacists should stand ready to provide advice and address any questions regarding the pertussis vaccine. Pharmacists can also play a pivotal role in promoting vaccination awareness and uptake and advocating for vaccination. Here is a list of useful resources and a QR code to our microsite for more information.